Guys, how are you doing? You right? Can you please, just before we start, switch off the mic? Please, guys. Can you switch off the mic? Guys, mic off, please. Guys, please, just if there is anything, just leave a text, okay? Just text, please. If there's anything, just text, okay? Because sometimes you open the mic and you forget. And whenever I ask a question, just you can answer in the message. Like, can you hear me clearly now? Okay. Great. Guys, I am Muhammad. Just some of you are not Egyptian, some doctors, so just I'm from Egypt. And I am surgical trainee in orthopedic department and trauma in Liverpool University Hospital, entry. And I am an OSCE examiner in Liverpool University Hospital, okay? For medical student, last year medical student, 5th year medical student. I'm an OSCE examiner in Liverpool University Hospital, okay? I'm sure that all of you just passed PLAB 1, so congratulations. And you're starting the PLAB 2 now. And let me tell you, PLAB 2 is not about examining your knowledge only, okay? PLAB 2 is 50-50. What do you mean by 50-50? Let's start recording this session. Record. Okay.
This conference will now be recorded.
PLAB 2 is 50-50. What do you mean by 50-50? 50-50 means 50% knowledge and 50% IPS, interpersonal skills. Doctor, interpersonal skills is 50%? Yes, 50%. So interpersonal skills, does that mean that it is thank you and please? Because that's like, I'm being nice now. Interpersonal skills, no. Okay? Let me tell you something, PLAB 2, that I'm just telling you so we know the mistakes. PLAB 2, the failure rate in PLAB 2 is a lot higher than the failure rate in PLAB 1. But why do you tell us this? Why do you say failure rate when we've just started? Because we need to know what are the mistakes so we are able to avoid the mistakes from the start. Okay? So, in PLAB 2, I will give you a few words that you will follow, okay? When I've done my PLAB 2 exam, I have done my PLAB 2 exam 2 years ago. When I have done my PLAB 2 exam, and listen carefully to what I'm going to say now. Half of what I read and half of what I studied during the PLAB 2, I have changed when I started working in UK. Does that make sense? Again, half of what I have studied during my preparation for PLAB 2, after I started working in UK, I found that 50% of what I was doing was not the correct stuff. You understand, the guys? You can text message. You can send the messages, okay? You can send the message. So what do you mean by that? I mean, there is way difference between working in UK and just reading the stuff. Okay, I mean that in PLAB 2 there are a lot of things that will sound shocking for you, will seem ridiculous, but in fact this is how you should do, and this is how you should follow the rules in PLAB 2. Okay, for example, which I always like to give examples with UK, which all these things you will basically see, all this stuff you will see during the course, okay, and all this stuff. What are these things? These things are basically, for example, we'll pick one of these forms, just one of these forms, okay? Guys, this is one form about colonoscopy, okay? This is colonoscopy form. This is from the hospital. This is what I always use, and my guideline always hospital NHS, okay? In this form, this is something that you should follow. Do not listen to, in PLAB 2 especially, just NHS, just things that basically big difference and big gap in PLAB 2, things that doesn't make sense to you, but this is what you should do. In PLAB 2, you are always, this is the question, because these are the mistakes that people will do. In PLAB 2, at any question, that's what the question, exactly like this. You are an FY2 doctor. You are an FY2 doctor. You are an FY2 doctor. Okay. These are all the questions. You are an FY2 doctor. Okay. In the GP clinic. All right. In the GP clinic. 55 years old. 55 years old. Andy, Andrew, whatever, came to the clinic because he has some concerns. Okay. What are the mistakes that people do in PLAB 2 that we need to avoid? Okay. As I mentioned to you, okay, I have not been around the PLAB 2 for a while. I've been only around the PLAB 2 for 2 years, only 2 years, okay? But I've been living in UK for 9 years, since 2010. So don't ask me how, but yes, I've been here since 2010. And one of the things that when you live in the UK and when you know the system, it is not exactly what we think it is. PLAB 2, it's easy and difficult at the same time. What did the question say? You are what? You can text, guys. What did the question say? Just something come in the exam, but you will never see these forms anywhere. Yeah, alhamdulillah, people in my course, I've got about 1,200 doctors since, like, you know, some people haven't had the exam yet. They don't share this stuff. They don't share it. Because if we do share it, everybody will know these things, and then everybody will share these things, and then the chance of passing and the passing score will be competitive. So this is not to be shared. Even I don't share it. I just leave it privately on my groups. Anyway, but the point is, forget about this. The point is, you could be talking for 8 minutes and you don't pass the station, and you could be talking for 4 minutes and you pass the station. Did you understand how? Did you understand the difference? How can you pass? How? Just knowing the guidelines. So please, guys, for PLAB 2, just follow guidelines. Just follow what must be done. That's it. Okay? That's it. Just try as much as you can to follow guidelines. Okay? Number 2, and as I mentioned to you, you can be talking for 4 minutes and pass, and you can be talking for 8 minutes and not pass. Now, let's go back to our question. You are an FY2 doctor, so you are a Mickey Mouse doctor. Right next to FY2, Mickey Mouse. Write this word. Mickey Mouse. Mickey Mouse. Mickey Mouse. Mickey Mouse means in PLAB 2, guys. In PLAB 2, I don't know if I'll find this form here. If I find it, it will be great. Okay. Okay, no. Okay. In PLAB 2, guys, Mickey Mouse doctor means that you are an FY2 doctor, that you cannot do anything by yourself, and you always have to go back to your senior. Okay? You always have to go back to your senior. And always your job is right down next to Mickey Mouse doctor, your job is stabilization. Write down to make sure the patient is stable. Okay. You are an FY2 doctor. Now we know Mickey Mouse, stabilize the patient, and I will tell you now what do I mean by stabilize the patient. Now, GP clinic. What is GP clinic? And what is the difference between? So the first point is, who are you? So who are you guys? Who are you? Can you answer me, please? Who are you? Who are you in all the stations? Who are you? No.
Mickey Mouse.
No.
Mickey Mouse.
Mickey Mouse. You are a Mickey Mouse doctor, guys. And that's why I don't know if you, before you came to this session, you know or not, that's why our passing score is very high. Very high. I don't know if you've heard about me before you attended the session or not. I don't know. Maybe some of you did. Maybe some of you didn't. Okay? But because it is simple to pass, and you could be stuck in the exam, and you could get 3 attempts, and you could know sometimes people don't pass after even 3 or 4 attempts, because it is السهل الممتنع. I passed OET, guys. Can anybody translate السهل الممتنع? Anybody who passed the IELTS كده ربنا فتح عليه can translate. Okay? So if you know what must be done, then you will actually be able to approach it and pass it easy. Internship doctor, a medical student can pass it. So who are you? Mickey Mouse doctor. Okay. This is the first point that you need to know in PLAB 2. I am a Mickey Mouse doctor. Okay. So if you have a patient with pyloric stenosis, child 6 weeks, pyloric stenosis, what is the first thing that you should do? What is your job here? What is your job? Pyloric stenosis. What is your job? You can write in the message. What is your job? Your job, perfect, is after taking history and everything, is actually stabilizing the patient, giving the patient fluids, the child, EBG, blood, ultrasound, this Mickey Mouse stuff. Can you do surgery? Can you do surgery? Okay, what is more important? Is it talking about surgery or stabilizing the child? Stabilizing the child. Okay, that's number one, something as a start. Who are you? Mickey Mouse doctor. Okay, where you are in this question, where you are in this question, GP clinic. GP clinic, it's, are there beds in GP clinic? Are there beds in GP clinic? Can you sleep there? Can we admit there? No, you cannot admit. So GP clinic, you cannot admit. Okay, what about A&E? Can you admit in A&E in the hospital? Can you admit in A&E in the hospital? No, you can't. This was a trick. Yeah? This was a trick. I was just tricking you. No, you can't. In A&E, you observe. You put the patient under observation. In A&E, you're going to keep the patient under observation. But in the A&E, you can refer. Okay, so in A&E, you can refer to the department within the hospital. You can refer to the department within the hospital. So if you have a patient who's coming to the GP clinic, can you at any time say admit? Can you at any time say admit? No, you can't. You refer the patient. In A&E, yes, you can refer him within the hospital to a department, but in A&E you can observe. Okay. Another question, if the question said you are in the cardiology department or you are in the psychiatry department and the patient has a psychiatric problem, would you say I will refer to psychiatry? No. Why? Because he is in the department. Or she is in the department. Okay, so who are you? Guys, this is actually the principles of PLAB 2. Who are you? Mickey Mouse doctor. Okay. Where you are. where you are. Where you are is very important. GP, A&E, hospital, the department itself, all these things are important. So you know, should I admit? Should I refer? Should I observe? Okay? Now, the third question, they said to you, anyway, so they said to you, 55 years old Andrew. 55 years old Andrew. So whom you talking to? Whom you are talking to? Whom you are talking to? Okay? Okay? Okay. Guys, write in brackets. Write in brackets these words. Child. Write baby. Write baby in brackets. Write baby in brackets. Write in brackets baby. You are talking to a baby. You are talking to a child. What do you mean by that? This is so stupid. What do you mean by that? Guys, this is the way I talk to my patients. This is the way everybody talk to the patient in UK. This is how I deal with the patient in UK, okay? I'm talking to a baby. What do I mean by that? If you are talking to your dad, would you say to him, I will do ESR and C-reactive protein? Would you say that? I will do LFT, AST, ASCP, TBT, CCB. Would you do that? Would you do this to your father? Would you do this to your mother? Would you do this to... No, you wouldn't. So basically, you are talking to a child. When you're talking to the patient, he is like a baby. Remember this word. So it's this word, under this word, a lot of things come, but obviously we are not doing the PLAB 2 today. We are just giving you hints about how to approach, but PLAB 2 is a vast, like when I started PLAB 2, my course was 10 days. Today my course is 42 days because we did the last new station. So basically it's 42 days. So basically these are principles. You are talking to a baby. Okay. So after you knew these principles, there is one important thing that I would like you, once you open the door, you should be like what? When you open the door of your cubicle in the exam and you go into the patient, you should be like what? Khalas, I'm opening the door and I'm going to the cubicle. Switch off the mic, please, doctor. Mute the mic. You should be like what? These are words that I always like me to talk to you about management plan. Yes, Andrew, we have medical and non-medical. Okay, Andrew, the plan, things that we will do and things that you will do. Things that you will do, such as diet, exercise, smoking, alcohol. Diet, you should do this. What do you think about it? And things that we do. So now there is what in management? In management, there is what? There is two-way conversation. You are talking, you are telling him about something. He is basically coming back to you. You are saying something else. He's coming back. Andrew, I would like to do this. Would that be all right? No, doctor. Andrew, I'm thinking that should be done. Andrew, what do you think of that? Andrew, what do you think of this? Andrew, I'd like to do some investigations to find about this. What do you think? How do you think? However, in history, how can I help you? Then he gives you presenting complaint. Then the conversation is basically question goal, answer, question, answer, question, answer. However, I said I will give it 1 mark because you can acknowledge, you can say sorry about something bad, you can say well done about something good. However, in management, that's when you will need to take his permission, and that's when you will take his opinion, because you have 3 different ways of management. Could the management plan be 3 different ways? Yes. And then you should take his opinion, and then it becomes like 2-way conversation. Am I making sense? Guys, am I making sense? So do you understand now that IPS actually goes with management more than history, because history taking is actually question and answer, but management is when I take his opinion. It's when I ask him, when I tell him, that's what we think it will be done. What do you think? Should we go further? Should we do that? Should we do that? So please, guys, when should you start management? When should you start the management? At 2 minutes? Because that's what everybody does. By the way, I am giving you facts. I'm giving you facts. I'm giving you what everybody else does. They say at 6 minutes bell start the management, but we're not gonna do that. We're gonna start as soon as possible. As soon as possible. As soon as I finish, okay? Because imagine if you have a station where you need to counsel the patient about diet, exercise, smoking, alcohol. Diet, exercise, smoking, alcohol. Do you think you could counsel him about diet? He eats very bad food. He eats non-healthy one. Then you start saying, well, I think you should eat white meat instead of red meat. I think you should use olive oil. I think you shouldn't use this. Do you think 2 minutes will be enough? 2 minutes will be enough. 2 minutes and just things going on back and forth. No, not going to be enough, 100%. So, this is the marking. This is how things go, okay? This is how things go. Okay. When I started doing the OSCE examiner, okay, they have trained us onto certain things in which we are looking for. By the way, the exam, is it subjective or not? Do you think if I listen to you and another examiner listen to you, would he give you the same mark? Do you think? If I listen to you and somebody else listen to you, would he give you the same mark? Would he give you, like if I give you 5 out of 12, would he give you 5 out of 12? No. However, when I started being a mock examiner, they have given me criteria. They have given me criteria. Criteria for what? If I pass you, my colleague will pass you. However, the mark will be different. Did you understand what I said? Did you understand what I said? If I pass you, he will pass you. But the mark is not going to be the same. It could be I give you 10, he gave you 11. It's not going to be 10 and 5. Because we have a certain criteria in which things that we use to judge you and put the mark. The main thing, because it's many things. One of the main things is being safe, doctor. Being safe. Being safe. Write this word big. Write this word very big. Write this word very big. Basically, being safe means what? Being safe means what? Means don't kill the patient. Being safe means don't kill the patient. Okay. What are the differential diagnoses of headache? What are the differential diagnoses of headache? I have a patient who's coming with headache. What are the differential diagnoses? Can you write down, guys? What are the differential diagnoses of headache? Guys, differentials, not differential. Differentials, please. Okay? Okay? Okay. Okay. Guys, the differential diagnosis of headache, number one, meningitis. Number 2, subarachnoid hemorrhage. Number 3, space-occupying lesion. Space-occupying lesion. Number 4, GCA. Number 5 and 6 and 7 and 8 and 9 and tension headache, migraine, simple headache, high blood pressure. What did you understand from what I just said? What did you understand from the order that I've just given now? Yes, the most serious should be excluded first. the most serious. I said meningitis, subarachnoid, GCA, specific occupying lesion, and then I started saying tension, simple headache, hypertension, migraine, everything else. If I have a patient, by the way, as I mentioned to you, I'm not going to say everything in 2 hours now, but I'm just trying to open your head. But the course is long, 40 days long. If a patient is coming and is complaining of vomiting, what should I be looking for? Vomiting and diarrhea, for example. First thing I should be looking for. اوكي ايوه دكتور شيماء. دكتور شيماء كده ايه؟ دكتور شيماء كده يعني دكتور شيماء. اوكي guys, dehydration. Dehydration. If you have a patient with vomiting and diarrhea and you don't put in the back of your mind dehydration, that he could be dehydrated, and be careful not to miss examining him for dehydration and manage him for dehydration. You are not a safe doctor. Do you understand? I'm giving you examples. Do you understand? A patient, by the way, not everybody will do this because it's a long, PLAB 2 is a long course. PLAB 2 is big course, and you need to have this kind of stuff in every single scenario. You have 400 scenario. 400 scenario, but don't worry, because this 400 scenario, we made them in 8 structure, 8, 9, 10 pages. Every page has about 40 stations. Every page has 40 scenario structures. Now, what I say to you, a patient who is coming with 65 years old, 65 years old, 65, any 65. What is the first thing you should think of? Any 65, any cancer. Cancer, which we call it flows. We say it flows, okay? Flows. I will tell you now what flows is. So basically, there are some principles, okay? Whenever you have 70, 65, 80, and 2, 3 years old, what should you have in the back of your mind? Again, whenever you have 2, 3, 4, 5 years old and 80 years old, 79, 75, what should you have? Something that nobody does, but we do. Something that nobody does, but we do. We do. Nobody does. We do. Whenever you have a patient who is young, very, very young, very, very old, what should you think of? You should think of NAI. NAI, non-accidental injury, abuse, okay? These are principles, guys. Principles that things that throughout the whole course I'm giving, we always implement stuff in the head that thanks to God, you know, I'm always lucky and blessed that many of my people don't really share. They share everything, but not the precious stuff. Whenever you have a patient, guys, are you following me? Are you following? This is just general things, yeah? This is just general stuff. Whenever you have a patient, 25 years old Alicia, 25 years old Alicia, or 25 years old Andrea, what should you think of in the back of your mind? Something that will be there all the time. Something that will be there all the time. You must use it. You must use it. Guys, write down 4 P's. 4 P's. P. 4 P's. Write down 4 P's. What is 4 P's? Period. Pills. Period. Pills. Pap smear. Pregnancy. Again. Period. Pills. So this is for most ladies. So pap smear, you cannot ask him 18, 16, 17, but over 25, 30, 40, you know. So always think in the back of your mind 4 P's. 4 P's. If you have any female, what should you think of? 4 P's, and it will be there and you must use it. Okay? 4 P's or P4. Call it 4 P's or P4, whatever. All right. Now, again, if you have a girl, for example, 22 years old, and you are suspecting ectopic pregnancy, you are suspecting ectopic pregnancy, what should you have in mind? What is the questions that when you ask, you know that there is ectopic somehow coming? What is the criteria? Late period, severe abdominal pain, okay? Sometimes dropping, bleeding from the front passage, okay? And when you do ultrasound, it shows ectopic. Everybody will do this. Everybody will do this. Everyone. Everyone will give the diagnosis of what? Everyone will give the diagnosis of what? Ectopic. Why the whole PLAB 2? I have this mnemonic for everything. So you see one mnemonic for like 12 station. That's what we do. One mnemonic for 12 scenario. Okay? So the causes of ectopic, 3 P's and 2 I. 3 P's and 2 I. What's 2 I? 2 I, IUD, and infertility medication. IUD, infertility medication. Okay? 3 P's. What are the 3 P's that I should think of? PID. PID. What else? What else? PID and what else, guys? Give me, guys. I'm listening. PID and what else? Previous ectopic. Perfect. And what else? The last P. The last P. The last P. Yeah, procedure. 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 طيب صلوا على النبي. The patient I'm taking a history from, by the way, the complication and the risk factors, it's our thing. It's our thing. Don't worry. Not many people do these things. Don't worry. So whenever you go, you need to reach your diagnosis. You need to reach the diagnosis. Not only that, I need also to ask about the complication. Dizziness, fainting. Not only that, I need to ask about the cause. Because what if this patient said to you, doctor, why did I have ectopic pregnancy? How would you answer her? How would you answer? How would you answer? If the patient said, why? Would you be able to answer if you did not ask about the risk factors? That's my point. My point is, I take history for 3 things. Things sound nice now, but it is difficult. You must practice it, and you must know everything in every station. This is the way. In order to get 12 out of 12, in order to pass with high score, pass for the first time, things like this. Okay, so this is why we take history. Okay, now let's talk about the structure. We have write down. We have psychiatry structure, which I use for all psychiatric cases. We have pediatric structure, which I use for any case of pediatric. We have gynecology structure, which I use for any gynecology station. Any gynecology, one structure. We have counseling structure, which I use for any counseling station. We have teaching structure, which we use for any case of teaching. What's the case of teaching? Always be loving PLAB 2. Teach your colleague anything. A teaching station, it's must. Okay? We have a structure for angry patient. Any angry patient, how to deal with. Okay? We have a structure for refusing the patient. So basically, PLAB 2, yes, it is 400 station, but it's about 9 or 10 structure. Every structure is in 1 page. Obviously, it's not that simple because yes, we have 25 or 30 pediatric scenario. However, yes, we do have one structure, but in every station, there is 1 or 2 lines that you need to know. And in management, again, 1 or 2 lines you need to know. So that's what I'm trying to say by structure. Structure that will suit any pediatric, structure that will suit any counseling. And we have a medicine structure. A medicine structure, it's a structure that will suit any emergency station or any patient who is coming with a lesion, skin problem, joint problem, okay, heart problem. It's called medicine structure. So that's a general medicine structure. So there is a structure for everything. Let's give you example about the medicine structure. Guys, let's give you example about the medicine structure and let's show you how you can do 60 station. I can give you now 60 station. Basically, I'm not going to give you the 60 in deep, in depth, in details, but basically I will show you what is the best way to study. Are you all following me? Are you all following me? So I'll give you a quick way of how to make PLAB 2 5-6 structure. Look, this is the medicine. I call it medicine structure for any case of medicine. For any case of medicine, medicine structure. When the patient comes to you, we know who are you. This is something you don't forget. Who are you? Mickey Mouse doctor. Whom you talking to? You talking to a baby. Where you are is very important. At the end, you are like a wolf. Okay. Now let's go to the medicine structure. Medicine structure, write down P1, P2, P3, maftosa. Again, P1, this is our medicine structure. P1, P2, P3, maftosa. What is P1? P1 is presenting complaint. Presenting complaint. This is the presenting complaint. P2, past history. Past history. P3, write down data. Data, write down. P3, P3. So P1, P2, P3, maftosa. Maftosa. P1 is the presenting complaint. P2 is past history. P3 is data. And then maftosa. Okay, what is P1 presenting complaint? How can I help you? Doctor, I have abdominal pain. I have headache, whatever. This is the presenting complaint. Headache. Okay, what or how should you ask about the headache? Should you say to him, since when? How did it start? Anything that makes it worse? Always use an open question. Why? Because when you use an open question, the patient can tell you something that if you use the closed question, he will just answer you. He will just answer you even though he's got something to say. So always use open question. Okay? Can you walk me through your pain? Can you walk me through your pain? Can you tell me more about your pain? Can you elaborate? Okay? So then you are elaborating the presenting complaint. Then the patient will say to doctor, it's in my head, it goes here, it goes there, it goes there, and then he asks, he tells you everything, or you ask about the rest of the headache, and then the headache is finished as what? What is the headache? In my structure, what is the headache? What is the headache? Headache. What is the headache? It is my, where is in my structure headache? P1. Now I finished exploring the headache in P1 and I am still in P1. What is the next question after the headache? What is the next question after I explore the headache? No. Anything else? Apart from the headache, I am still in P1, guys. P1 could be 2, 3, 4 symptoms. P1 could be 2, 3, 4 symptoms. So anything else? Anything else? Anything else? Then he tells you fever. Then he tells you fever. What should you do? What should be your question? He told you fever. What should be your question? No. Fever became a presenting complaint. Fever became a presenting complaint. Fever became P1. Can you tell me more about the fever? So the patient will say to you whichever, okay? So can you tell me more about the fever? Because fever still, is it presenting complaint or not? Is it presenting complaint or not? Yes, guys. Then you finish the fever. What is your next question? Anything else, Dr. Mazin? Perfect. Thumb up. Perfect, Dr. Mazin. Anything else? Anything else? How can in headache? Weight loss important in headache? How can I help you? The fact that you are asking the flows in your structure, you are excluding without realizing. You are giving differential without realizing. So if a patient is coming with headache, if a patient is coming with headache, if a patient is, guys, one of the doctors have said, does it help in ectopic, for example? Ectopic is gynecology structure. تمام؟ سلمني نظيف هسلمك نظيف. I said to you, there is gynecology structure There is medicine, which includes everything but no gynecology. There is counseling. Okay, you understand? I've just even said to you, there is a structure for everything. Okay, shall we move forward? Gynecology has a structure. Okay, gynecology has P1, P2, P3, P4. Actually, okay. Pediatric has a structure. P1, P2, bird, triple D maftose. So every something. Psychiatry, MC Famish, all psychiatry. Anyway, let's go back to this because this is the whole of the PLAB now. Okay. S is night sweat, yeah. Not night sweet, night sweat. Okay. Anyway, so what was I saying now? Yes, I was saying flows. Yes, so flows is everywhere. Flows is everywhere. So now, presenting complaint P1, anything else, differential flows. Okay? Now, come to P2. What is P2? Guys, what is P2? What is P2? What is P2? Guys, what is P2? What is the number? What is the number next to 2? What is the number next to 2? No, but what is the number next to 2? I said past. What is P what? 2, yeah? So how many things I need? How many things I need now? 2. So the 2 are, before I ask about past history, I will ask past history of presenting complaint. So before I ask him, do you have any medical condition? It's even more important to ask him, have you had what? What is the presenting complaint here, guys? What is the presenting complaint? What is my presenting complaint? Headache. So before I ask him, do you have any medical condition? I should ask him, have you had this before? So P2 is 2 questions. The first question is past history of presenting complaint. The second question is past medical condition. Past medical condition. Jama'ah, are you following me? Are you following me? Are you following me? So the patient was coming with vomiting. Before asking him, do you have any medical condition? I should ask him, have you had this vomiting before? So, guys, is that in any medicine station or is this just in the headache? The structure is for every, apply it anywhere. Apply it anywhere. Apply it anywhere. Anyway, so 2 questions in past history, okay? And in brackets, Dr. Mo, yes, but you didn't ask us, about the past surgical history. There is a surgery structure. Clear? In case someone needs to ask now to say, you have not said surgical history, there is a surgery structure. Clear? Clear? There is surgery structure, right? Anyway, so P2 is finished. Then P3 is what? What is P3? What is P3? P3 is DASA. What is DASA? Diet, exercise, smoking, alcohol. Okay? DASA is diet, exercise, smoking, alcohol. Plus or minus. Plus or minus, what do you mean plus or minus? What do you mean plus or minus? Plus or minus means that DASA is fixed everywhere. DASA is fixed everywhere. Plus or minus 2 things that some stations I do, some stations I don't. Sexual history and the drug history. Sexual and drug. This is plus or minus. Doctor, why do you say plus or minus sexual and the drug? Because in some stations it's very odd to ask about sexual history. That's why I said plus or minus. But in any station you can ask diet, exercise, smoking, alcohol. So plus or minus sexual history and drug history. Shall we move forward? Shall we move forward? Okay. Now, after DASA is maftosa. M is medication. Medication. A, allergy. F, family history. T, travel. Travel and what? T is travel and what? T is travel and what? And the contact. Travel and the contact history. O is occupation. S, social. Social means who do you live with? Who do you live with? A, what does A stand for? What does A stand for? What does A in maftosa stand for? A in maftosa. A. I said maftosa. The last A. The last A is anything else. So start your structure with an open question, end it with an open question. Start with an open question, end with an open question. That's how you always. So anything else you think I've missed? Is there anything else important for me to know? So always end your history with open question. Now. This is medicine structure. So what do you think the thing that you actually need to study? What do you mean by you need to study? That you need to know. In this structure, what is the thing that you need to know? Basically, what will be different from one station to another? Again, what will be different from one station to another? I mean in the structure, presenting complaint, DDs. Dr. Zara, thank you very much. DDs, guys. So the differential is the one thing that will be different from one to another. So all of them, P1 explore, anything else explore, anything else explore. However, the only thing that is different will be the differential. Okay. And we know in the differential that there is one important thing in the differential, which when you do differential, what should you start with first? When you do differential, what should you start with first? Yeah, the most serious. The most serious, okay? And then after differential is flows. Flows is fixed everywhere or not? Flows is everywhere, yeah? Flows is everywhere. One of the doctors say what's common. Guys, no, not what's common, please. Guys, please. What's common is common, okay? Back home, that's what we do, actually, that's what we use. But here, no. Exclude what will kill the patient first. ماشي يا دكتور ودينا؟ دكتور ودينا, being a safe doctor, I think you did not attend from the start. Being a safe doctor is exclude what will kill the patient first. Anyway, so now, when I study PLAB 2, I need to make things easy for myself because I want to finish quickly. I want to go to the exam. I want to have a structure in my head. So now we agreed that what will be different in this structure from a scenario to another. What will be different? DBs. Okay, so let's now tell you, should I take a picture or not? I will take a picture, okay. Let me take a picture, all right? Let me take a picture. Okay, so now what will be different is the differential, okay? How many stations do you want me to finish today? How many stations out of the 300 do you want me to finish today? I've got like 20 minutes. I've got 20 minutes, okay? How many stations? Obviously, in the course we go in details. But how many stations do you want me to finish? So now, what I'm going to talk about is what now? What am I going to talk about now? What am I going to talk about now? DDs, yeah? Again, now I'm going to talk about DDs. And I will take the DDs and put it in the structure and it became a scenario. Does that make sense? I will take the differential, put them in the structure in the differential, and then the scenario will come out in terms of P1, anything else, DDs, flows, past, to, base, and those. Are you following me? Guys, are you following? Yes, okay. So now let's do, okay, the differentials for 1, 2, 3, 4, 5. I will do now the differential for 11, 12, 13 station. 13 station. Okay, now I will do the differential for 13 stations, and now you will have 13 stations in your hand. Okay? Now you will have 13 stations in your hand, but obviously in the course we talk a bit in details, but this is how you will approach PLAB 2. Okay, so I will talk about one of the most common cases, tiredness. Tiredness. Obviously, this is my structure, and I say it on the video now because nobody will come out and say, no, this is mine. This is mine, and everything I say is mine. This is my copyright. There is no copyright in our society and the community. But now let's talk about the causes of tiredness, which maybe some of you might have found it anywhere, but it's mine. What are the causes of tiredness? Or what is the differentials when I have a patient who say, I am tired? What should I ask as a differential, as causes? Yalla, Bismillah ar-Rahman ar-Rahim. Bismillah ar-Rahman ar-Rahim. Yalla, you listening? You listening? Zero the listening. Yalla. A, B, C, D, E, F, and my name is Muhammad. A, B, C, D, E, F, Difficult? A, B, C, D, E, F, These are the causes of tiredness, and now you have finished 13 stations in PLAB 2. Take the causes, put them in the structure, the station will come out for you. A, B, C, D, E, F, Difficult? Shall we move to the second differential? We have not said anything. Okay. A, anemia and apnea. Anemia and apnea, obstructive sleep apnea. B, TB. C, cancer and the chronic fatigue syndrome. Cancer and the chronic fatigue syndrome. D is for diet, diabetes, depression, drugs, drug side effect. When I mean drugs, I mean side effect of medication. Can bad diet lead to tiredness? Again, can bad diet lead to tiredness? Okay. Can depression leads to you feeling tired? Yes. Can diabetes lead to you feeling tired? Yes. Can medication side effect leads to you being tired? Yes, like 2 medications. Write these 2 medications, citalopram and steroids. Citalopram and the steroids. It is a medication that causes tiredness through causing hyponatremia. Guys, am I clear so far? By the way, what are the medication I said to write down? Citalopram and what? These are 2 stations in the exam. It's actually stations. The patient is tired. Listen carefully to me, guys. Listen carefully. The patient is tired. Explore tiredness. Anything else? No. Then jump into differential. These are the differential. Then where will you find that he's using the steroid? Which question that you will find he's on steroid? Maftosa. You remember Maftosa and the structure? You remember Maftosa. In N, medication. What medication are you using? Steroids or citalopram? Clear. Anyway, so now A, anemia and apnea. B, TB. C, cancer, chronic fatigue. D for D. E. What's E stand for? Endocrine hypothyroidism. So E, endocrine, hypothyroidism. What's F stand for? Fibromyalgia. What's Mo stand for? Mo, my name. So mood. Is mood important? Is it important to ask a mood in a patient who's tired? Of course. When you have no mood, you cannot function, you cannot do anything, you don't have any appetite for anything. Yeah, okay? Guys, so now in my course, what do? I teach you how to ask about anemia, how to ask guys. I said some guys, pregnancy is gynecology structure, guys. Pregnancy is gynecology structure. Ectopic is gynecology structure. We have gynecology structure. Clear? I think the doctor is Dr. Mustafa. I think he came late. I said there is gynecology, there is pediatric. We've got about 10 structures. 10 structures. Okay. So now in the course, what I teach you, how to ask about anemia, for example, apnea, TB, as we go along, so you know. But now, don't forget one thing. Don't forget one thing now, because there is one thing now that will fade. Why do I take history? Why do I take history? To reach the diagnosis, the cause, the complication. Diagnosis, cause, complication. So if the station is if the station is anemia, the patient will come with tiredness, heart racing, lightheadedness, but do not forget to ask about what if she's a female. She is a female. Don't forget to ask about what one of the causes of anemia. Period. Perfect. 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 And don't forget to exclude what? Because it's one of the complications, or it's vice versa with anemia. If a patient is coming with anemia, it could be cancer or not.
Yep.
So please, but anyway, Dr. Mo, I forget to ask about cancer. Don't worry. Why don't worry? In my structure, what comes after DDs? What comes after DDs in the structure? Go back to the structure. Flows. What is flows? What is flows? Lumps, lethargic, weight loss. Yes, lethargic, lumps, with cancer symptoms. So you are safe. With the structure, you are safe anyway. You will ask. There is no harm. Anyway, let's go back. So I just give you a little hint that do not forget when you are taking a history, you are taking the history to ask about, to reach diagnosis, to find out about the causes, and to also reach the complication. And anyway, every single one of these are a station, a scenario in the exam. When I did these structures, I did not do them haphazard. I did what needs to be in the exam, and I've done it. Yani, you will never find any of these letters not important. They are all exam stations. Do you understand? Do you understand? They are all scenarios. They are all scenarios. So I'm not going to put something that it's not a scenario. We gather. So how many stations here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, medication, 12, 13, 14. You have 14 scenarios. And every scenario you will ask the question of it, but you have a structure at the end of the day. Okay? So now let's give you another group of differential. Let's give you another group of differential. For example, a patient is coming with shortness of breath. A patient is coming with shortness of breath. Okay? Again, do you remember the structure? Do you remember the structure? Guys, do you remember the structure? Now, I am only discussing what? I'm only discussing what in the which piece in the structure I'm discussing now. DDs. I'm discussing DDs, yeah? So if this patient comes, how can I help you? Doctor, shortness of breath, that's P1. Tell me more. I will accept anything else. Tell me more. Then differential. After differential, flows. Then P2, P3 mactosa. So now I'm discussing the differential. The differential DDs. What are the causes of shortness of breath? Differential diagnosis of shortness of breath. Differential diagnosis of shortness of breath. اوكي طب صلى على النبي. صلى على النبي. Differential diagnosis of shortness of breath is passion. Write down passion. You know Muhammad Hinidi in the Arabic film? Passion. يا باشا. passion. يا باشا. Yeah, this is an Egyptian film for guys who say that he's speaking Arabic now. When I speak Arabic, it's like a joke, little joke. Okay, so Pasha. Pasha is P-A-S-H-A. These are the differential diagnoses for shortness of breath. Shall we move forward? These are the causes. Shall we move forward, or do you want to know what is Pasha? Of course, we want to know what is Pasha. Pasha is P. P is 3 P's. P is 3 P's, which are pneumonia, pneumothorax, PE. Again, what is P? What is P in Pasha? Pneumonia, pneumothorax, PE. Okay, what is after P? A. A is asthma. A is asthma. S, smoker's cough, COPD. Smoker's cough, COPD. H, heart failure as well as MI. Heart. A, anaphylaxis. Difficult? So now everywhere is a station. And now when we discuss every structure, so but in details, basically. In details. Okay? So you have this scenario, pneumonia scenario, pneumothorax scenario, PE, 3. Asthma, 4. Smoker's cough, 5. Heart failure, MI, 6 and 7, and anaphylaxis, 8. 8 scenarios. So 8 scenarios and the 14 tiredness. So how much? How many stations now? 22. But obviously, you go in details. Obviously, the structure is fixed. Obviously, what comes after these guys? The differential, Pasha. Pasha for shortness of breath. What comes after Pasha? What comes? Flows. Dr. Mazen, افتح المايك. Open the mic, please.
Hello?
Dr. Mazen, can you hear me?
Yes, I can hear you.
Yes. Is fever important, Dr. Mazen? Is fever important here?
Yes, it's very important.
Why? Pneumonia,
yes.
Pneumonia, yeah, okay, for example. Okay, is lumps and bumps important, Dr. Mazen? Lumps and bumps and lethargic in these cases.
Yes.
Cancer, yeah, brother, cancer.
Yeah,
Wow, shortness of breath, lung cancer, صح?
Yeah.
You forgot cancer, yeah?
Yeah.
I did not put it here because cancer is a part of the structure, that's why. Okay? Okay.
Yeah.
Loss of appetite, a sign of what as well? Symptoms, cancer. Weight loss, lung cancer. Night sweat is a cause of shortness of breath. TB.
Yeah.
TB. Yeah. So guys, are you following me? So Dr. Mazen, the fact that you ask about flows, you have already given differential before you think of differential. Does that make sense? يعني flows is your umbrella. Flows is your backup. Even in the mock, when I give them the mocks in the academy, they start with flows. They forget, then they start with flows until they remember differential. And then in the course, obviously, we explain everything in detail. Shall we move forward to another group of stations? Shall we move forward? Fine. I will shock you now. I will shock you. You will be shocked now. I will talk about differentials of weight loss. Differentials of weight loss. Differentials of weight, by the way, the whole course is like this, yeah? Differentials of weight loss. Weight loss. What are the causes, the differential diagnosis of weight loss? Dr. Rodina, she loves the malignancy. Differential, Dr. Rodina, malignancy. Dr. Rodina. She's a safe doctor. Dr. Rodina is a very safe doctor. طب صلى على النبي طيب. صلى على النبي.
طب السؤال.
Write down now. يلا. Do you remember A, B, C, D, E, F, Mo? Do you remember? A, B, C, D, E, F, more. Do you remember it or you forgot? I was like causing some sort of a trick. I was taking you out of A, B, C, D. I put Pasha in the middle, and I'm going back again to A, B, C, D. Yalla. A, B, C, D, E. Leave the F, move. Take the F out, move. Difficult? يا جماعة, difficult. We're about to finish PLAB 2 now, guys. From 2 hours. We're about to finish PLAB 2. Is it difficult? A, B, C, D, E, move. Without the F. Is it difficult? Okay. These are the differential diagnoses for what? What are we talking about now? Differential for weight loss. Yalla. A is anorexia and appetite. Yeah? Appetite. If the patient is having bad appetite, can it be a cause of weight loss? Weight loss or not? Yes. Anorexia and appetite. B. What does B stand for? TB. B. Can TB lead to weight loss? Can TB lead to weight loss? Yes. C. Cancer. C. Cancer. Can cancer lead to weight loss? Dr. Mo, I forgot cancer. What is your backup for cancer? What is your backup for cancer? What is your backup for cancer? Flows. What is your backup for TB? What is your backup for TB?
Flows.
What is your backup for appetite?
Flows.
طب يلا مش مشكلة كده أنا يعني إيه؟ بصوا أهو D. What is D? Again, it's 4. Same as the other structure. 4. Diabetes, diet, depression, drugs. Same the other 4. Can diabetes lead to weight loss? Can diabetes leads to weight loss? Can the diet lead to weight loss? If you don't have a good diet, you lose weight. Depression. Medication side effects. Slimming tablet. Can a slimming tablet lead to weight loss? Okay. Anyway, so D. What is after D? What is after D? What is after D? E. What does E stand for? Endocrine. Hypo or hyper? Hypo or hyper? Hyperthyroidism. Hyperthyroidism. And at the end is Mo. What is Mo stand for? Something can lead to weight loss. Mood. Difficult. Is it difficult? So I will take this differential. And I will implement them on my structure. So it's a P1. Anything else? DDs. Flows. P2, P3 maftosa. The station will end nicely. You don't need anything. Things will go nicely. However, you will just a bit of digging here. Okay? And we have hypo there, hyper here. Can you give me a clue word for what are the questions for hyper or hypo? Hyperthyroidism or hypothyroidism? What are the questions? Yeah, skin dryness. Yeah. Period, constipation, sweating. طب صلوا على النبي. قولوا على صلوا السلام. صلوا على النبي. BMW. Write down, guys. Write down. Hyper or hypo? BMW. What's BMW? B is bowel and palpitation. Yeah, palpitation, the Egyptian accent. Palpitation. It's not palpitation, it's palpitation. So the Egyptian accent. So B is bowel and palpitation, yeah? Egyptians understand this. I'm Egyptian. So B is bowel and palpitation. Okay? So that's B. Bowel and palpitation. Bowel here, diarrhea or constipation. Constipation hypo, diarrhea hyper. Great? Clear. So B is bowel, either hypo or hyper, either diarrhea or constipation. What is the second M? What is the second letter? M is mood. What is W? W. What is W? Weight loss and weather preference. Weight loss or weight gain. And weather preference, preference to hot or preference to cold. So it's either hypo or hyper. Clear? BMW. So what is BMW? What is by the way, there are other things that, you know, eye, vision, we know that, yeah? But I'm just giving you something as an ignition. And the rest is in the course. Just showing you some sort of, when you structure your head, things will be clear. But obviously, you know, like if we stay till tomorrow, I will keep giving you structures. That's the thing, you know, till tomorrow. If we stay like for 24 hours, just structures. And we go into more details. Anyway, so what is BMW? B is bowel, either diarrhea or constipation. N is mood. W is weight loss or weight gain. Clear? Clear. Fine. Lastly, I will give you another. Now how many differential? How many cases now have we done? How many cases in general? Because all these cases in the exam, all these are cases. That's from, you know, the number of 300. This is out of the 300. Yeah. This is all scenarios. Okay. Okay. Lastly, I'll give you the last differential and then I will go. Okay. Even though it's quite big, the last part, but I will just do it quickly. Okay. Quickly. I'll do it quickly and I'll be sitting down. Quickly. Quickly. And I will be sitting down. Okay. Okay. Guys, the last differential is differential diagnosis for headache. For what? Headache. Differential diagnosis for headache. For headache. Differential diagnosis for headache. طيب صلى على النبي كده. تمام؟ Differential diagnosis for headache. It will be يا دكتورة رودينا. فين دكتورة رودينا؟ malignancy. دكتورة رودينا. What is دكتورة رودينا؟ malignancy. على طول. malignancy. Okay? I know, no, not ABCD. No, not ABCD. Guys, look at my head. Look at this big head, yeah? Look at the head of the patient, and I want you to take it layer. From outside to inside. In Arabic, من برا لجوه. يلا, in English, from outside to inside. From outside to inside. This is in English. In Arabic, من برا لجوه. من برا لجوه. طيب, من برا لجوه يعني ايه? What is that? What is that? Skull. So the first differential is head injury. Head injury. يلا, من برا لجوه. From outside to inside. Head injury. What is under the skull? What is under the skull? What is under the skull? Meninges. Meningitis. Yalla, meningitis. What is under the meningitis? What is under the meninges? What is under the meninges? Brain. What is space occupying lesion? Space occupying lesion. Space occupying lesion. Clear so far? I will draw it for you. Okay? Then it will be more clear and I can see you this on the let me draw it and then Guys, can you look at this? I draw nicely, yeah? I draw nicely. Can you see me, yeah? Now you'll see the picture. Yeah. Can you see the picture, guys? No, you can't see me still. Yeah, 1 second. Yeah. Can you see the picture, yeah? What is that written in Arabic? من برا لجوه, which means from outside to inside. From outside to inside. So what is the first thing here? Skull, head injury. What is under the skull? Meninges, meningitis. What is under the meninges? Brain. Brain. Can you see, guys, please? Can you see? Everybody's drawing. Basic drawing. Space occupying lesion. What is under the brain? What is this? What are these? What are these? You can write down in the message, yeah, and I like interaction. What are these under the brain? Eyes. So, vision problem and glaucoma can lead to headache. Can lead to headache. Yes. And what is this underneath here? What is this on the side here? On the side, what is that? Beautiful. GCA. Yeah? 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 GCA. Yeah? Cheap. Yes. GCA. Yeah? Look. Look. GCA. Yeah? Look. Okay? GCA. Janssen arthritis. Okay? What is this? What is that? Is stroke differential of the headache? Everybody forgot. Everybody forgot. Is stroke differential of the headache? Stroke differential of the headache? Yes. Now I am left with the Mickey Mouse headache, migraine and tension headache. Migraine and tension headache. Migraine and tension headache. That's it. Now, what did I miss? One of the most serious headache I missed. What did I miss? Cluster. Serious. I mean serious headache. Subarachnoid hemorrhage. Am I safe, doctor? Am I safe, doctor, now? Am I safe, doctor? Right. Okay, I will show you something very beautiful. You like it? I will show you something you like it. Okay? I will write it down now. All right? I will write it down now and you will love it. We all know math. Yeah, everybody. Guys, I am not going to ask about subarachnoid here. I am not a safe doctor. I am not a safe doctor. Can you read this? Can you read now? Doctora Rodina, can you open your mic? If she's
Yes,
still
doctor.
there. I don't know.
Yeah.
Yeah. What is
Yes.
this? Can you read? What is this? Read. What is that?
Meningitis.
What is that? Minus.
Meningitis.
What is that? What is this now? Minus, yeah? Meningitis minus what?
Fever.
Equal what?
Subarachnoid hemorrhage.
So subarachnoid hemorrhage is meningitis without fever. ايه يا عم اللي انت بتقول ده؟ What are you talking about? Subarachnoid hemorrhage, meningism, irritation, but with no fever. So neck stiffness, yeah, without fever and rash, to be precise. So if I ask about meningitis and there is all the symptoms of meningitis but no fever, what does that mean?
Yeah.
It's no fever and rash, yeah? It's minus fever and rash. So that's why I did not ask about subarachnoid hemorrhage because if I ask about all the questions of meningitis, it will cover what? Subarachnoid hemorrhage. Go and read at home. Don't worry. These things have been, you know. So meningitis minus fever and rash equal subarachnoid hemorrhage. Plus some specific things you will say, doctor, it is the worst ever headache I've had in my life. and all these things is discussed in the course in details. I'm just giving you how to structure yourself as an example of this is how to be structured. You don't need to spend so much time. If you have 8 years gap, I don't care. If you have 10 years gap, no problem. If you have 15 years gap, no problem. If you're not even a doctor, you can pass PLAB 2. Actually, this is the truth. This is the fact. Okay? It is a fact. Seriously, it is a fact. Okay? And the passing rate, the less you know, the more you the chance of passing, you know. So because the more you know, the more you talk. The more you talk, the less you listen to the patient. Does that make sense? Plus, the more you know, the more you forget the basics, the stabilization. If you are a cardiologist, you want to talk more about cardiology, and then you forget about stabilization. Okay? So, this is how to structure yourself, and this is how you start studying by just having a structure for everything, and everything have a structure, everything you follow a structure, everything you go and follow the NHS. I mean, this is not available much. These things are not available much because these things only if you work in UK. These things only if you work in UK. Basically, it's a page for every, I mean, every topic is one page. Like one page means, for example, this beautiful blue paper is gastroscopy. Yeah, gastroscopy. Gastroscopy, again, it's a form. You don't need to fill this form. You don't need to fill it in the exam, but I bring it because the questions that you must ask to the patient are the questions that you must take in what? The question that the NHS put here, entry hospital. The question that they put here in the form, for you as a doctor, you must ask. What does that mean? That means that these are the questions that you must ask in this case. Does that make sense? Anyway, guys, have a lovely night. And just to follow what I said, simple stuff. Practice is the key for PLAB 2. Practice is the key for PLAB 2. You just need to practice all the way long. Practice is the key. I wish I could stay more, but obviously, you know, as I mentioned, if I stay till the morning, I will be just saying things till the morning, okay? Do not listen to anybody say anything, okay? Yes, guys, let's give you, and then you write down and then you follow. No, do not, because there is no basics, guys. There is no basics. Why you follow? Follow things like NHS, okay? Follow things NHS. Do not follow whichever people think. You know, every 5 minutes. You know, I say just follow the NHS. Be safe, doctor. Be Mickey Mouse, doctor. Be like a wolf. Your patient is like a baby, and that's what you need to do. One of the doctors, she said to me that she will ask a question. Dr. Mustafa, Dr. Mustafa what? Mustafa? Dr. Mustafa. Dr. Mustafa Mahmoud, you don't need to remind me of Al-Badawi because I know your brother, Allah yarhamu. تمام؟ Dr. Muhammad, Allah yarhamu يعني. Never mind Al-Badawi, ya basha, I know your brother. He is one of the best. He was one of the best people. يعني ربنا يرحمه. You don't need Muhammad because there is somebody who يعني I used to love more than Muhammad. Just to let you know, okay? ربنا يرحمه. Okay, guys, PLAB 2, simple exam. It's not difficult. Don't go deep. It's very easy to pass. It's very easy to fail. Easy to pass, easy to fail. Okay, it's very easy to fail the exam. If you are not safe, if you are, I tried my best to just give a bit of everything. Okay, but if you are not safe, if you don't listen to your patients, obviously management has, guys, there is no days for the course. It's not how many days. It's unlimited until you pass the exam. The course was 10 days. Then it became 12, 14. Every day they put a new station. We do on the course every time. New station in the course. And the course is recorded. It's not recorded. The course is not recorded. But for example, today's session is recorded. I recorded today's session and I added it to the course. But does it make sense for me to repeat the same session? does it make sense for me now to repeat this session? Does it make sense? If it's recorded. So that's what I do. I record my material. The course used to be 10 days. Then we did 4 more days. It became 14. So the more the stations, the more I do online, the more I record, and people will watch at any time. So the course you can watch at any time, anywhere, and you have unlimited access till you pass your exam. I don't switch off. I don't take you off the drive after 1 month, after 2 weeks. No. Till you pass your exam, you have access to the course. Till you pass your exam, you have access to the new station. Till you pass your exam, you have access to everything. Dr. Moda, my exam is in next year. No problem. Next year, the year after, I've got people in the course since December. They haven't had their exam. So it is unlimited till you pass. Clear. If you start today, yes, there is an academy. Yes, in Liverpool, guys. In Liverpool. Yes, we have our academy in Liverpool, up and running, mocks. The mocks only NHS doctors. I do not employ doctors in the mocks with me that even done PLAB. All of them English doctors. English, okay? English doctors. And all of them mock examiners with me in Liverpool University. Okay, so basically, the course is unlimited. So if you start it now, it's the same process if you started next month. Next month, Dr. Mo, I want the course. I will give you an access. An access to everything we have done. What about the new sessions that we do? The new session that we do, new session. I record, I add. But the earlier you do it, the better, because you listen more to online like this. But if you don't, it's recorded and I added to the course. Guys, did you understand the principle? Because many people ask questions. So basically, I record everything. So if you join the course now, it is 40 lecture. Okay, 40 lecture. What if you join it next month? Next month, it will be 44 lectures. Okay? But people who join the month early, for example, these people, they attend the 4 lecture online, live, and we still have them recorded. Does that make sense? Does that make sense? So people who will join the course in 2 months, same process. But the course, instead of 40, it becomes 48. Why 48? What are these hours that I add extra? It is the new stations, yeah? These are the new stations. When I say 48, it's not 48 days. It's 48 lectures. So some lectures are 2 hours. Some lectures are 1 hour. Some lectures are 3 hours. Like today's lecture, 2 hours. So any new station we do. Okay, guys, let's go. We have an online session. Everybody attends. What if you can't attend? What if you cannot attend? Now you can't attend the lecture. Like today's lecture, people missed it. People missed today's lecture. They will have it recorded. I always record and add to my material. Always recorded, all the time. Okay? And the reason why I do this, because I don't want people to stick to a time. You can watch anytime, whenever, whatever. It doesn't really matter. And some people join the course a month before the exam. So when they have everything ready, they can watch with any speed they want. So they have all the course now. Do whatever you want to them, as quick as you can. The academy, this is the online course, guys. This is the online course, okay? The online course has the Simman, has the examination. The online course contains everything. The online course contains everything. Everything. Examinations, Simman, everything is in the course, okay? And also, I used to do online mocks during the lockdown. I used to do online mocks like now. I pick one of the doctors, for example, Dr. مثلا Mahmoud, Mustafa, Mazen, Dr. Rudaina, and that during the lockdown when we have time. I used to do live mocks with them. Live mocks like this, and I used to record it. So in the course, you will find the course. You will find recorded mocks. You will even find the revision. What do you mean by revision? You will find pediatric, for example. Pediatric as a branch, I have done it in 5 hours. Are you all listening? Pediatric, I have done it in 5 hours. During the lockdown, I used to do what we call a revision. Guys, we're going to do revision today. Pediatric revision. I take 2 hours, all pediatric. So in the course, the branch and the revision. Are you following me? The branch in 5 hours. Revision in 2 hours. Psychiatry, 5 hours. Revision 2 hours. Surgery, 5 hours. revision 2 hours. So when I say 42, it's not 42 all new. No. In this 42, one of the days revision pediatric, one of the days revision psychiatry, one of the days revision tiredness. So the course has everything you need. Everything is in the course. The course, revisions for people who are trying to revise quickly, okay? Everything you want and even more. So when I say revision, I mean revision. I mean 2 hours of pediatric, 2 hours, like, but not all the branches I've done revision for, obviously. That was when we were, you know, and this is the online course. The academy is something else. Is when you come to UK, I will not do this course in the academy in person. No. The academy you come, we have an English doctors, English, yeah? All English. We have an English doctors. We do 1 procedure a week. We do 1 SIMAN session a week. Procedure means one of the doctors is in the academy teaching you procedures, teaching you how to perform aseptic technique procedure, and showing you and observing you doing it once a week. And once a week SIMAN, that's the SIMAN. SIMAN is emergency, yeah? Emergency cases, talking mannequin, emergency station. Once a week procedure in the academy, and in the academy, all examinations have been done on people, on videos in the academy. If you want to watch them, they are there. All the examinations. The examinations are recorded on television screen, procedure in person, SIMAN in person, plus the mocks that we perform Saturday, Sunday, the mocks. If you want to attend the academy, it's the same as the course, £250 and 200 if it's a group of 5, simple. Group of 5, £200. Both are separate. If you want to book the online first, I don't care. If you want to book the academy, I don't care. If you want to book the online and you don't want to book the academy, I don't care. There is no problem. If you want to book both together, there is no problem. If you want to book one and one later, there is no problem, guys. There is no problem. The online course, £250, £200 if you are a group of 5. 5 people, 200 each. One person only, 250. The academy is the same. 5 people, 250, 200 each. One person only, 250. Okay? Do I have to book both together? No, you don't. You want to book both together? Okay. You want to only book the online first? It's fine. The academy later? It's fine. No problem. Okay? The academy includes what? Includes unlimited attendance. If you come before the exam 6 months, I'm happy. Stay 6 months. If you come before the exam 1 month, it's fine. Unlimited. Online course, for how long do we have it? Unlimited. Until you pass. But one thing I always tell my people, don't share. Don't share the material, guys. Guys, I don't know. I'm sure most of you have asked about me before the come, because already October people are there. Some people have already started. I mean, they are starting in October. Our passing rate is very high. Very high. Very high. Alhamdulillah. Alhamdulillah. The passing rate is very high. Okay? And don't ruin it, because I always say this to people. Don't ruin it. Why don't ruin it? The material that you have, and the way that you have, and the approach that you have, and the notes that you have, the videos that you have, it's not anywhere. It's not anywhere. I'm telling you. It's not anywhere. But if you share it, people already are sharing. People are sharing. And people have my course, took my course, and they started saying we're going to give classes with my course, for example. So it's fine. But I always update. I always add new stuff. I always add. And one good thing, alhamdulillah, the only person who is in the NHS and giving a PLAB 2 is me. I know this for a fact, because I will never leave the NHS for any amount of money. This is out of order. For me, I could have left it, but I will not leave it. I will not leave it. Why? One main reason, because it is reflecting on PLAB 2. It is reflecting on PLAB. I would never leave NHS. I would never leave it, because it's reflecting on PLAB 2. So do not share anything. I'm talking like this. Why? Because some of you already have the material now. I've given the material to some of you, because some of you have joined the course already. That will start. Okay? Can you join next week? No problem. Can you join the week after? There is no limits. You can join at any time, because everything is recorded. If you don't attend, if you miss something, it is recorded. Guys, do you understand the principle, yeah? Everything is recorded. People who join early, they get the chance to attend more live. That's it. But people who join late, they will have this live session recorded. Clear? Clear. So today, people joined. They attended live. What about next week? We had another session recorded. But people who joined end of the month, they will have all these sessions recorded. That's the only difference. Because I will not repeat it again because it's already done. It's already given. So when you join early, you literally have more live sessions. If you join late, it's the same process. So yes, there are notes, one of the best notes, but my people are very good. I put it on the drive. People don't share it. People don't share it. People have it to themselves. Okay? And I'm lucky in that way that people are very good. I'm dealing with nice people. Okay? Some people do share, but because when you share, you think that you are benefiting people, but you are affecting yourself. Why? Why when you share material, you're affecting yourself? Simply because there is a passing score, simply because everybody's competing, simply because when you compete against each other, the passing score is high, so you can do good, but you still fail the exam. Does that make sense? Guys, people passed with 30 days, people passed with 6 weeks. Wallah, ya doctor, wallah, دكاترة they share. They do share, yeah? That's why when I come at any video and I say these are my structures, I say it and I don't care because it's mine. Nobody can come and say it's not yours because it is mine. People do share it, but it is mine. Anyway, preparation for PLAB is important. Practice is a must. Practice means have a study partner. It's very easy to have a study partner because you have a group, WhatsApp group. So WhatsApp group that we do private groups for all the doctors in the course. They take from there. WhatsApp group is, if you have any question, you ask there. Yeah? WhatsApp group, if you have any question, you ask there. Okay? Please, difference between online and academy. Guys, online is all the course. The 42 lectures that you study and you study before you come to UK. Academy is just clinical. Clinical. Clinical means cannula, catheter, SIM-man, practice, insertion like female catheter, male catheter, blood, okay? Everything. It is actually the clinical part, okay? And that's when you meet people and you do practice in person. Like my academy now, okay, is people practicing together at the moment. So in the academy is the clinical part. I don't give this course anymore. This course is online. Academy is to teach you the procedure. You see the mannequins. You see how clinical comes in the exam. How to do catheter, cannula. Okay, how to take blood. Okay, how to do SIM-man. All this in the academy. Plus examinations. I put all examinations again on a video just exclusive for the academy. Plus mocks. Mock exam. You come and they have a mock exam. Doctors working for the NHS. We don't have anybody who's just like simulating. No. NHS. All my doctors who gave the mocks. I am one of them. In my all NHS. This is for the academy. Academy is different. You can book this and this separate. With the كام واحد mocks. One mock, guys. The course is very cheap, by the way, in comparison to all the courses. One mock in the academy. If you want to book more, you book more, okay? And one thing I want to tell you, because to save our time as well, to make your life easy, can you all please, can you all save this number? Please, guys, do me a big favor, because I don't want to sound rude. Look, this number, you all save this number. All save it. I've sent you this number. This is Dr. Mo, not me, somebody else, and Dr. Basma. Guys, they answer this number all the time. This is the number to ask about any details, to book anything. This number and this email, yeah? Clear? Dr. Muhammad. Yeah, okay. Clear, guys? Is the online course enough by its own? Look, Dr. Anas. Dr. Anas. صلى على النبي Dr. Anas. I have done. Listen carefully. Listen carefully. You don't know me yet, guys. 88 doctors, you don't know me yet. But you can ask about me. You can ask. Feel free to ask anywhere, okay? The online course contains everything. What do you mean by that? When I have done examination notes, I've done notes for examination, videos for examination. Did it make sense for me to put them in the online course? Did it make sense? Does it make sense if I have academy to put examination on my online course? Does it make sense from a business point of view? Does it make sense for me to put the examination video in the course? But I did. I did. Same man. Does it make sense for me to put the same man and to explain same man in the online course? Think. It doesn't make sense. Really, it doesn't make sense. Yeah? But I did. I did. So in the course, you have everything. Can I pass the course? Can I pass PLAB 2 without the academy? Yes, you can. Of course you can. The notes for the examination, again, I could have kept it to the academy. I put it there. I put it there. Can I tell you something? Is everybody listening? Is everybody listening? Guys, can you all listen to me? Guys, alhamdulillah, I am known in PLAB 2. But do you know when I do mock in the academy? Do you know the academy mocks? Do you know the academy mocks? And ask your friends. Ask your friends. At the end of the day, when the examiner starts giving the feedback, guys, are you listening? When the examiner starts giving the feedback, wallahi, I put it online. I make a meeting like this, like what we do now, and I put the video like this, and the examiner starts giving the feedback in the academy online to the online people. Okay? That's why, you see, in the academy, I let people attend from Egypt, from back home, the feedback of the doctors online. That's why, when you ask, guys, who should I take the course with? Dr. Mo. Dr. Mo is not only because of the medical part and the knowledge part, because something you don't know about me, in PLAB 2 and teaching is my thing. I love it. It brings money, but I love it. It's not because it brings money, because I love it. I love teaching. That's why I enjoy, okay? And you all can see in the groups, Facebook groups. You know Facebook groups, if you see Facebook groups is only talking about my course. Did you see this? Did you see this? Only talking about my course. Why? Because I can kill myself in terms of effort for people to pass. I thrive in people passing. This is my thing. My main issue is you to pass. People, when they come to the academy, simply, I let them observe sometimes, but if they pay for the academy, sometimes, if it's not busy, I let them observe the mock in person. They come and they sit down and they observe the mock. They observe the student and they observe the mock for free. Why? Why do I do this? Why do I put everything? Because my main concern is you to pass. If you have my online course, you have my support. I don't really have an issue with academy or not, but is it important to do mocks? This is the question. Is it important to do mocks and attend the academy? Is there a difference if I don't and I do? Of course. That's one thing I say. I put everything. Yes, but is there a difference? Of course. Because when you come, you see English doctors. One of them, she walks you through the procedure once a week. You see me. I walk you through the same man, like in person. Okay, you attend the mocks, you observe mocks, and you go with the mocks, and you sit down in an atmosphere that looks like the exam, and you do rotations, move on, next station, and you move in the station, you do examination in the station, in the mock. So obviously it is different. Does that make sense? Do you understand? Obviously, it is different. It's not the same. Of course, I mean, of course, you will have extra things in person. So the academy is procedure. The academy is Simman. The academy is mocks. This is the academy. Plus examination you watch. Plus the PNF. Plus these things you see in the academy. So a lot of things that you see that it cannot, you know. Simman, I'm not going to ask about Simman. Is the Simman types the same? Yes, guys, we do Simman. Look, everything is toward the exam. What I do in PLAB 2 is toward the exam. Done. Okay? That's what I do. And then the Simman, I bring you in the place, I say to you, do it. Do it while I'm here, yeah. Do it. Start. And form of station. Okay? So you don't need to book both of them together. You can book both of them separate. Okay? No, guys, there is no MOOCs in the online course. There is no MOOCs in the online course, okay? There is no MOOCs. Of course, no MOOCs. The online is online. And my online course is similar to prices of people who are nothing to do with PLAB 2. You know, everyone passes the exam, take the course with Dr. Mo, wants to teach PLAB 2 because he took the course with me, wants to teach PLAB 2. They charge these people, when they start, they charge the same what I charge you. So I would not give anything with the online course because I know it's very cheap. I know it's very cheap. It's no comparison with the effort that you will take in the course, okay? So this is the course, okay? And how many weeks, guys? I mean, what you can, I mean, it's unlimited, but what you can, you know, afford, 1 week, 2 weeks, 10 days. With 1 week, you will do everything. You will do mock, you will attend the procedure and Simman. With 1 week, you will do everything. Better to make WhatsApp group to book. Yes, group of 5 guys. Group of 5. Simply go at any Facebook group. For example, we have PLAB B. We have my page. Whatever Facebook, you go under that group of 5. You will make the group at the end of the day. You know, by the end of the day, because people like, unless I don't know how many in October group now, because many people joined, but it's not a problem. Okay. Dr. Mo, can we join next week? Of course. Can we join in 3 days? It's fine. Can we join in 1 week? It's the same principle. You will join. I will give you all the material. You will start induction, day 1, day 2, day 3, day 4, day 5. I will add you to WhatsApp group. If there's any question you ask there, there's no difference if you start now or next month or in a week. But obviously, the earlier, the better. The earlier, the better, because there's no difference. So start early, practice early, book the exam early, because we never know what's coming soon. Okay. So if you have a question, can I start the course in 5 days? Same process. Same process. Yeah. You will make a group of 5, and then you will add this number. Please, guys, please, this number. This is the one that's for you at any time. At any time, this number is the one that at any time they answer you. Okay? At any time, this number is the number, okay, that the waiting for any time you text, okay, to text WhatsApp. Okay? Okay, the course online, £250, group of 5, 200, academy is the same price, and these are the details if you want. So you can basically have everything. Here you go. Okay? And the reason why I give you this number, because sometimes I don't answer right away, because obviously I'm doing a lot of other things. So give me 1 moment. Here you go. Okay? So it's not out of being rude. It's out of being, I have thousands of doctors, and seriously thousands. I've got about 1,400 doctors who joined the course from December, because they have not had the exam yet. Guys, start early because the competition is high, and PLAB 2 is actually there's high competition now. High competition now in PLAB 2. Start early, prepare early, and the one thing to advise you, what is the most important thing for PLAB 2? What is the most important thing before we go? What is the most important thing for PLAB 2? Practice. Practice, okay? Practice. Can we pass with practice without anything? Yes. Can we pass with a good academy but no practice? No. Clear?
لا هو الخبز
Guys,
السخن
clear.
تاعكم
Because I'm gonna switch off the
Hello,
meeting now.
خبز اوكي.
Clear. You can pass PLAB 2 without an academy but with just practice. Clear. But you cannot pass with an academy with no practice. Does that make sense? Obviously, some of you will think this guy is stupid, you know. Some of you now will be thinking he's stupid. He's telling us you can pass without an academy but with practice. Okay? Without any course, but with practice. He's telling us this, yes. Yeah. Okay? But we cannot pass with a good course without practice, yes. Okay? What can we do? Guys, the quarantine not now. The quarantine not now. Okay? The quarantine not now, guys. Okay? The quarantine is in everything changing every single day. I would not discuss something for people who's gonna start the course now, and the quarantine is like, it could be when they come in UK, it's like in 3 months. Okay? So don't jump. Start the course, finish the course, get the visa. After the visa, think of the quarantine, because maybe there's quarantine now, maybe there is no quarantine after 1 year, after 2 months, after 1 month. Does that make sense? يعني اتنين مالهمش امان. ها؟ اتنين مالهمش امان. اتنين مالهمش امان. الفرامل والكوفيد. Okay? The car brakes and the COVID. You don't trust them. Okay? Okay? Because with COVID, you don't know. Today, there is lockdown. For example, there is quarantine. Tomorrow, there is nothing. Okay? So 2 things. One of them is COVID. Okay? So don't think now of the quarantine, but people are practicing in the academy. We are doing the mocks. Everything is fine. Okay? But my advice is start studying as early as you can, because people have been preparing for a while. People have been preparing for a while, yeah? For the academy, how long should I be in UK? Guys, I said it depends. 1 week, in 1 week, you will do everything. Okay? In 1 week, you will do everything. 1 procedure a week. Guys, all the procedures a week. Once a week, 1 session a week, we do all procedures, yeah? And 1 session a week, we do all procedures. 1 session a week, we do Simman, yeah? Yes, yes, yes. The tutor will do the procedure that you need in 1 day, of course. And I do the same man in 1 day, of course, and that's it. Okay? What kind of material we shall receive with the course? Good, okay. Number 1, all PLAB 2. All PLAB 2 videos, all PLAB 2 scenarios in videos, exactly the video that you've seen today. Okay? All PLAB 2. Number 2, notes. PLAB 2 notes. Number 3, WhatsApp group. In WhatsApp group, you ask questions, I answer you, somebody else answers, he answers, maybe I answer this question or somebody else will answer you. WhatsApp group, we are all in the group. 4, any session we do, you are entitled to till you pass. Great. Great. If I booked the golden package and there was a lockdown when I decided to come, guys, Dr. Ahmed. Dr. Ahmed, don't worry. If it comes to, there is a lockdown, yeah, your money will be refunded to you, of course. And if you want to only book the online course, it's fine. You can book only the online course. There's no problem, okay? There is no issue. If you book the golden, it's fine. There is lockdown, you can't come. What can we do, okay? Yeah. Can't take the course. Guys, please, Dr. Suzanne or Dr. Sue, the course, because I keep answering the same question now. Same question, okay? The course, yeah, the course, guys, £250 online. All PLAB 2 material, videos, notes, any session I do, you attend, WhatsApp group, you are in to ask questions. This is what we call a silver package, online. Golden is both. Is the online as well as attending the academy for the procedure and the Simman and the mock, 1 mock. Okay? Okay, if you can read this, please, if you don't mind, okay, you can read this. It has all your questions. because look, guys, read this message, shown everything. Silver package is just the online course, 250 and 200 of a group of 5. What is the content? All the content are there, yeah? Guys, Dr. Ahmed, this is changes happened during the COVID in PLAB 2. This is marketing, yeah, brother. This is marketing. We're gonna explain the changes that happen in the due to COVID in PLAB 2, brother. This is people sitting in Egypt bored, okay? Bored. They wanna just show excitement. COVID changes during the PLAB 2. I've done everything in the course. Don't worry. Everything in the course. I don't need to attract your attention by saying I'm sitting in Egypt chilling and saying, well, I will tell you the changes. Everything is in the course. Don't worry. You understand? This I will tell you the changes. What changes? Everything is in the course. Everything. What happened? How many stations it become? How many stations it used to be? What are the changes? I am in UK. I think I am in UK. So I'm reflecting everything. I'm not in Egypt, which means I am in UK. So I'm reflecting everything with you, Dr. Ahmed, in the course. Everything you need. Everything. COVID, the stations, how to manage COVID. Let me show you something. Because it's important that we are on the same page. Yeah. Dr. Ahmed, can you hear me? بص يا دكتور أحمد، بص يا حسن. One thing I will tell you, yeah? I don't brag about anything myself. I don't brag about myself. Like, I see people just talking nonsense. I will do the changes about PLAB 2 in COVID. This is all nonsense. This is just things to grab attention of people. This is but nothing, yeah? This is my COVID, for example, cases. What is this, Dr. Ahmed? What is that? Yeah? Guidelines for initial management of suspected or confirmed. What is that, Dr. Ahmed? What are you can see now? What is that you can see now? What is this? Can you have an idea what is this? Dr. Ahmed?
الجايدلاينز بتاعت
brother, I'm telling you so you know. The only person who's teaching PLAB 2 and working for the NHS is me. يعني الحمد لله, I'm struggling to keep the NHS in my life. Wallahi, I'm struggling to keep the NHS. The only person that I say it because, yes, the only one who teaches PLAB and working for the NHS is me.
Yeah.
I'm keeping the NHS to keep updated with everything. But obviously, I don't need to write down for you guys to attend today's session. COVID, I will tell you the updates. And I'm sitting in Egypt. How would I know the updates when I'm in Egypt? صح?
Yeah.
صح? How would I know the updates when I'm in? But the thing is, everything is guidelines. That's it. The new and what happened, there is nothing is that happened in PLAB 2.
اللي كنت اقصده انه بقوا 15 stations instead of 18.
يا باشا إبداع في الكورس. إبداع. Everything. There is a session in the course called Update to PLAB 2. And this is the real update, not the Mickey Mouse update. Okay? Update to PLAB 2 in the course, but obviously it is in the course. It is for the course. Why it's for the course? I wouldn't do this. I'm sorry to tell you. I wouldn't do this free. Do you know why?
Because it's your effort.
Because when I say update to PLAB 2, it is update to not Mickey Mouse update in Egypt. It's not I'm sitting in Egypt saying the update to PLAB 2. It is actually the update to PLAB 2. It is actually the guidelines for COVID, which you're not going to see anywhere. As you can see, this is the guidelines in my hospital. That's why I wouldn't give these things for free. Doesn't make sense. But I could bring people update to PLAB 2 COVID changes because it's nothing. I would not tell you anything. But because the exam is a competition, because people are competing in the exam, Alhamdulillah, our people are getting the top score. There are things that I don't need to grab people's attention and say, well, I will tell you the update about COVID. No, this is private for me. Why? Because I actually have updates. I actually have things because I'm in the NHS. I actually have things to say, which I don't want you guys. If somebody is sitting at Dr. Ahmed now watching me and he take things for free, such things that will affect the candidates, I wouldn't give it like this in a session. Does that make sense?
Yeah.
But I will give it to you. I will give it to you. Why? Because you should have something. You should be a step ahead. Does that make sense? I would give you everything like how to approach things like this, how to, but I wouldn't give you things that I know. Like for example, I have these things which I only give. You see, all these are forms, okay? But I wouldn't give to Dr. Ahmed to anyone. Look, can you see? These are all forms from the NHS. Okay, I wouldn't give to anyone. Why, Dr. Ahmed? Why wouldn't I give it to anybody? Why wouldn't I give these things to anyone?
لما تبقاش مشاعر.
Because if I give it to everybody, when you go to the exam, everybody will be competing against you. صح? صح?
مظبوط.
And one thing about our doctors in my course, the passing rate is like 95%. Don't ask me why. ربنا بقى. ربنا. The passing rate is very high because we have things that only for the course. I would not write in the you know update to PLAB 2 and changes that happen during to bring attention, and it's nothing. But I will keep it to myself. Does that make sense?
Yeah. 100%.
So there is a whole session in my course called Update to PLAB 2, but I wouldn't give it to you. And then people join the course, and then you go to the exam, and then you both have the same, because the phone consultation, 5 stations of phone consultation. I have done a lot in phone. You know what I did in phone consultation. You know what I did when you attend the course. Can you hear me, Dr. Ahmed?
Yeah.
When you attend the course during COVID times in my hospital, NHS have put guidelines on how to speak on the phone. Guidelines on how to speak on the phone. Yeah? And I used to take pictures of this, bring it in the course. But do you think is it sensible for me to tell everybody this now in a session that's free?
Yeah.
Not out of being selfish, but out of caring about your students, caring about your doctors.
Yeah.
Because when you take my course, I want you to be the best. Does that make sense, guys?
Yeah. هو نوع إنه
Right? Does that make sense?
يفهم.
I want you to be the best.
Yeah.
This is my point. So when I'm selfish, it's because I want you, Dr. Rabab, in your exam, nobody compete against you. And in your exam, if you are doing the exam for the first time, you pass with a very high score, comfortably with a very high score. Yeah? Anyway, guys, because now it's, I think it's, Dr. Rabab, alhamdulillah, if you can ask, you will know. Passing score is very high because I keep things exclusive, and I have a lot of things that my doctors know, nobody else know. As I mentioned to you, because of working in NHS, in the hospital in UK, and being a mock examiner, that I put effort as a mock examiner for no money. Yeah, no money in comparison to the courses. I go and I'm a mock examiner at Liverpool University for medical students with very, very, very less money. I could put this effort in PLAB 2, but it is reflecting in PLAB 2. Somehow it's reflecting on the course. Anyway, but payment methods, Egyptian bank, Bank Masr for Egyptian people, UK account for people in UK, and PayPal for anybody. So PayPal, Egyptian account, UK account, okay? And again, this is the number, please guys, this is the number to text, please, this is the number to text, okay? All right, this is the number to text. I know Dr. Yes, Dr. Rabab, wallah. Alhamdulillah, Dr. Rabab. Alhamdulillah. Alhamdulillah, and the passing score is very high because our things are different. You understand? Different. You understand? Guys, have a good night, and I hope I answered all your questions because it's 20 to 10 now, and I wish you all the best. I wish you all the best, and I've sent you the number, send you the details on the chat box now. Okay, I will send the details again. Feel free to text. If you want to make a group of 5, feel free to go on any Facebook group, and we'll make a group of 5 very easy. Oh, is it showing you the whole? Why is it not showing the whole message, guys? Guys, it's not showing the whole message. I don't know why, but let me put the details. Are you all on the page? Are you all on my Facebook page? Guys, you can all go join this page, and I will put the details of the course now. Okay. Okay, great. The whole message is visible. All right. Guys, have a lovely night, and I wish you all the best because I'm working in the hospital tomorrow. I have a shift tomorrow, and inshallah you will do the best. And remember one thing. Remember one thing. Can you pass without an academy? Can you pass without a course? Can you pass without a course? Yes, you can. With what? Practice. But if you take an academy without practice, will you pass? No, you won't. No, you won't. Okay? Guys, have a lovely night. And I've sent you the page. You can join the page. 1 second. Yeah. This is my page, my Facebook page. You can join it for anything. And have a lovely night, guys. Yeah? Have a beautiful night.